Thank you for joining us today at the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle, specialist plastic surgeon of 30 years, and today I'm introducing Elena, a friend of mine. Together we'll be talking about all things plastic surgery.
Mark, on social media, Turkey, Bali and Thailand plastic surgery comes up a lot. And on those advertisements, there are always Australian people giving testimonials about how great their surgery was in those countries. But I also know Australian plastic surgeons aren't allowed to advertise that way. So why the difference?
The difference is we have a different regulatory system in Australia, and our health regulator has been very specific about how we can advertise and what we're allowed to say, and it's almost brought it down to basically no advertising at all. They don't have any control over the overseas companies advertising, therefore the advertising is skewed way towards the overseas market and not to the Australian market, and that's because of the regulation. The upside of the regulation is that the regulator in Australia is very strict about how we treat people, how we manage them, how we consent for procedures, how we describe procedures, how we look after them afterwards. It's a very strict process. In the overseas countries you've mentioned, I can't speak to the regulations of those overseas countries with respect to their plastic surgery, but certainly in the social media more recently, the Turkish in particular have had some major issues with their plastic surgery, and it's becoming more and more obvious that there's some problems in some of these companies, and the regulations possibly not as strong as they could be.
So Mark, what are some of the risks about having surgery in overseas countries?
I think the first thing that's really important is to know your surgeon. It's quite common for me when in fact, I think just about everybody I speak to, they come and see me if they've had a problem from some surgery overseas and they've come to see me. The conversation runs a little bit like this. I'll say to them, okay, so where did you have your surgery? And they'll say, well, I had it done in Thailand. And who is your surgeon? Well, what's his name or her name? Oh, I don't know. Okay. Which hospital is that? And they name a hospital. So you've gone over there to have an operation from a surgeon. You don't have any idea of his qualifications or anything else about him? No. Okay. Why have you come to see me? Well, I've come to see you because I've researched you. You're in Australia. You've got the right qualifications. You've been doing it for a long time. You've got good reviews. So I thought I'd come and see you. So can you understand that that doesn't make a lot of sense? You're going to somewhere overseas to somebody that you don't know, that you haven't qualified at all, to have a surgical procedure. And yet when you do have a problem, you don't go back to that person. You come back to somebody in Australia that's well qualified. It doesn't make any sense. And there are a lot of people that travel overseas and they have no idea who's going to do the operation. The biggest problem I've seen personally, and I have to be honest, I haven't seen any good results from any of these countries with respect to their plastic surgery, because I don't see people with good results. If they've had a good result, I don't see them. So I can't comment on whether people are getting good results but I can certainly comment on people that have had bad results. The thing that I've seen happen the most commonly is that at the operation, once the patient's asleep, the surgeon's decided to do something completely different. And there could be really minor things to, oh no, I think I'll put a different size breast implant in. Oh, I was going to do their eyelids, but I think it would have been better if I'd done a brow lift. And they change their mind and do these things whilst people are asleep with no consent. Now in Australia, that's illegal. In these overseas countries, this doesn't seem to be an issue. So that's been a major problem that I've seen. There has been a lot of press and social media comment about deaths overseas, and deaths in plastic surgery is very, very uncommon, and certainly Australia, it's extremely uncommon. It's not in some of these overseas countries. And there has been some issues more recently about problems with organ donation that wasn't expected by the patient at the time they're having surgery. And it's a really big problem. There is no real comeback on these overseas countries. There's no legal recourse to any of the things that are happening over there, and it's been a real disaster. And it's very sad for these people that are being treated in such a bad way.
Mark, I have been very surprised that people think it's a good idea to have a surgery in a tropical place and then sit around a humid resort to recover. What do you think about that?
I would have the same issues.
Okay.
It's interesting how people can look at that and go, it's really good. I get a holiday, have a nice little breakaway and get my operation done. Fantastic. The risks associated with that are humidity. There's certainly some bacteria that people and infections that they get in these overseas countries that aren't seen in Australia. The quality of the water, the travel particularly coming back from an overseas trip where you've had a general anaesthetic, the risks of deep venous thrombosis, so blood clots in the legs in the plane is quite frequent. There's a lot of things that don't make any sense with this, and it's all come back really to the cost. The costs on a lot of the procedures that they go over for have been increasing over time. People don't take into account the costs of the accommodation, the travel, and the need to go back if they have a problem and have more accommodation and travel costs to get something corrected. So it's not as clear as initially sounds out to be.
So, Mark, you mentioned you frequently see patients that have been overseas and are unhappy with the results and come and see you. If they didn't come and see you, what would their options be?
Well, their first option would be go back to the surgeon that did the procedure. So they need to travel back overseas. A lot of the places that are advertising the cosmetic surgery have a guarantee that you can come back and they'll correct things.
Okay.
But the problem is there's the cost associated, time off work, accommodation, travel to get over there. And a lot of people at the stage, if they've come back and are unhappy, are also unhappy because they've lost confidence in the surgeon that did the operation to go back there again. So I think that's a sort of guarantee that they give that wouldn't get used very often. The problem I have is when they come and see me is the documentation and all the paperwork that we would normally have in Australia doesn't exist. There's no communication at all with the surgeons over there, which means it's very difficult to fix an operation if you don't know what's happened during the operation, because some of the procedures they do are a little bit away from standard. It can be really complicated to correct procedures when you don't really know what's happened in the first place. The other problem is that as soon as somebody comes back to Australia and I treat their unhappiness by doing a procedure, then they become my patient. And it would be quite common if somebody's had a 50% result from the operation they had overseas, come back and I fix it to a 90%, I'm still blamed because it wasn't 100%. And a lot of the plastic surgeons feel that it's really difficult to get people really happy afterwards if you can't get them back to exactly the result they should have had in the first place. That means that most of the patients that are coming back from overseas with problems end up being treated in the public system. The government aren't happy that we're spending Australian money treating patients that have had operations elsewhere.
Thank you for joining us on the Gold Coast Plastic Surgery podcast. If you have any questions about anything Mark has spoken about today, please look on our website or call our inquiries team, who will be happy to help.